Next, we have Ms. Schakowsky from Illinois.
Thank you, Mr. Chairman, and I want to thank the witnesses. I have to disagree with you, Dr. Redfield. I think nowhere has the Trump administration's lack of leadership been more apparent than in our nation's nursing homes and long-term care facilities, where we've lost 50,000 residents and workers to COVID-19. So let's review some of the deadly failures. You delayed data collection on cases and deaths in nursing homes. You have not required states to conduct testing. You are not giving workers adequate PPE, and I agree with Congressman Doyle on that, to protect themselves. You are allowing facilities to literally kick residents out onto the street if there's a more profitable COVID patient to take their place. And since CMS Administrator Verma, who is responsible for the safety of our nursing home residents, has declined Chairman Pallone's invitation to speak, let me refer then to Dr. Redfield. The CDC website explains that your mission is to save lives by providing health information that protects our nation. So why didn't you require nursing homes to report any data on COVID-19 cases and deaths until May, 4 months after, you may remember, you told me about the first case in Illinois, January 30th, to report the case of human-to-human transfer. On June 4th, you testified before the House Appropriations Committee and apologized for CDC's inadequate, I quote, response to COVID-19 race and ethnicity data. Yet, the same day, CMS and CDC finally published COVID-19 data from nursing homes and failed to include race and ethnicity information. So when my office asked CMS about the exclusion, we were told to ask the CDC. So will you promise to include race and ethnicity information moving forward so that we can identify and address the racial disparities in nursing home COVID-19 cases?
Thank you, Congresswoman, for your question. First, I want to stress that since the early beginning of the pandemic, we've initially encouraged all nursing homes to report the cases through their health departments and through our National Healthcare Safety Network as of May 8th.
If I could just briefly interrupt on the word encourage. That, I think, is a problem, that there's been guidance, there's been encouragement, but what about mandating?
As I said, that as of May 8th now, it is a requirement that this be reported in through CDC, as CMS has made that required. And we are working to make sure this reporting is comprehensive to include ethnic and racial data. As well as I would put forth that we've worked hard to really accelerate training and retraining of infection control procedures in these nursing homes to try to mitigate the situation that unfortunately we did experience, as you pointed out, where the nursing home residents have taken a high burden of this initial outbreak. We will continue to work to get this reporting. This reporting is going to be forward-facing. CDC will forward the data to CMS. CMS will forward-face it so families can make decisions based on their understanding of how different nursing homes are performing. We have recommended that the nursing homes, as you mentioned, that they screen all residents, and we've recommended that they screen all workers in nursing homes on a weekly basis because we do believe this is an important area that we have to do more as a nation to protect infections.
And let me just say, this kind of suggesting and recommending has clearly not been enough in my view. This is the view of many observers, families, workers, that there is a crisis in our nursing homes, that it persists, and that we insist that the government do more to help. And I yield back.